Good evening, everyone. I thought that the song service leaders would have done a song in between, but I guess y'all can hear me? Sister Jen, you can hear me now? Oh, okay. All right, so if we can kneel, I know Sister Flo just kneel, just pray to close the story, but if we can kneel for our health focus. Dear kind and loving Father, as we are about to enter into our health session this evening, we ask you to help us to understand the importance of living healthy lives. We know that there are things around us that we have no control over, like the environment, but help that we may do all in our power to mitigate and to minimize the harmful effects. Continue to guide and direct us now for Christ's sake. Amen. All right, this evening I was asked, well, actually 2 weeks ago, 2 or 3 weeks ago, to look at the respiratory tract infections and Sahara dust. I was reaching out to my dear friend to try to get some local information. This is Edmund Blaze, for those of you who would know him. But he just managed to send me 3 slides that I would share with you, and I was able to do some other research. So I'm going to keep it very brief, and then we'll have all of the various reports that we are supposed to have. So I'm going to touch basically on respiratory tract infections, and then I will touch briefly on asthma, and then I would actually get into the Sahara dust. So I'll keep it very, very short. So right. So when we look at respiratory tract infections, I think I'm missing a slide. Okay, respiratory tract infections is divided into upper and lower respiratory tract. So I'm going to start with the upper respiratory tract infections. And these are illnesses caused by an acute infection which involves the upper respiratory tract. And these are areas like the nose, sinuses, the pharynx, and the larynx. And this commonly includes like tonsillitis, pharyngitis, laryngitis, sinusitis, and otitis media, which is the inner ear, and the common cold. So these are some of the upper respiratory tract infections. So this just gives you an idea of the anatomy of the upper respiratory tract. So if you look closely, you will see the sinuses and the nostril, the tongue, the palates, etc. And I mentioned some of this information on the upper respiratory tract infection, and this is an X-ray, so I'm not going to go into all of these minute details, but just to show you some of the graphics. So when we look at the pathophysiology of the upper respiratory tract, we see bacteria and viruses would cause harmful effects. And this is seen through direct hand contact. This is some of the, how it is spread, direct hand contact or by droplet infection. And it enters into the nose by inhaling, or through the immune defenses system, and then through the hair and the lining that filters will help to trap some of these pathogens. All right, so this is some of the defense mechanisms that would take place. And the traps in the upper respiratory tract, which coats by the mucus. So the mucus will actually capture some of the dust and the particles. And then it leads to it also impinges on the back of the throat, and it transports pathogens up to the pharynx and the larynx. All right, so this is just a pathway, so I'm going to move quickly through the pathway. So in terms of diagnosis, the diagnosis of upper respiratory tract infection is based on the symptoms, the physical examination, and the laboratory tests. And a lot of times, the doctors might not necessarily want to do the laboratory tests, which is not good, because sometimes you don't know if you're dealing with a virus or a bacteria. And if you go and treat the individual, not knowing if it's a virus or a bacteria, you can look at giving antibiotics, which treat bacteria, but they don't treat viruses. And therefore, you become resistant when you really need that antibiotic. Your body is not able to deal with it because you build up a resistance. And I'm not sure, Dr. Douglin, if it's doctors in Barbados, but when I was actually studying public health, we had a big issue with it because a lot of doctors abuse antibiotics, especially, take for instance, they have some persons that live in the US and they come back as returning nationals. And as soon as they have a cold or anything, they run to the doctor and say, "Doctor, I want some antibiotics." And sometimes the doctor will write up the antibiotics and give them. But really and truly, they have a viral infection, so they don't need antibiotics. And the more antibiotics you put in your system, the more resistant you become. So when you really now have a bacterial infection that needs an antibiotic to treat it, then the antibiotic, don't treat it, is of no use. All right, so that is some of the issues that we are faced with today. And because of the constant abuse, then we have to move from first generation to second to third generation antibiotics to the harsher stuff. So that is the issue the pharmacists will know that we are faced with. And some of the laboratory tests is you can actually do cultures, nasal swabs, throat swabs, and evaluate for allergies or for asthma. And you can also look for enlarged lymph nodes or sore throat, stuff like that. And you see just making sure you're seeing what I'm seeing. In the diagnostic tests, you have blood tests, you have sputum tests, you have x-rays, CT scan, and nasal and throat swabs. So all of these are some of the tests that the doctors would do. In terms of physical examination, in the physical examination of an individual with upper respiratory infection, a doctor may look for a swollen glands or redness inside of the wall of the nasal cavity, redness of the throat, enlargement of the tonsils, white secretions on the tonsils, enlarged lymph nodes around the head and the neck, redness of the eyes, facial tenderness, and other signs like coughing, bad breath, hoarseness, fever. These are some of the things that they would look at. In terms of treatment, and I'm not going to go into detail in treatment, you can either have pharmacological or non-pharmacological treatment. And as you know, as good Seventh-day Adventists, we like to use a lot of the non-pharmacological treatment. So patients would be encouraged to drink lots of fluid, all right, to make sure they hydrate. And then we also use vapors. I don't know how many of you during the COVID period would have used inhaling all of these vapors, but a lot of us, we did it in our household. We had all the menthol crystals and everything. That's like Dada and Peter. Okay, but we did it. So we got a little bowl with really hot steaming water, and you add in all the menthol, and you breathe it in and you inhale it. So that would help to prevent, we hoped, the persons from catching COVID. So all of those non-pharmacological treatments you can use. When it comes now to the pharmacological treatment, you can use NSAIDs, and notice most of these things have some form of side effects, especially as you get older. And antihistamines you can use. If it is bacterial, antibiotics, but you try to avoid the antibiotics for viral treatment. Steroids, to me, is almost a no-no, but there are instances where you might have to use steroids, especially if you're asthmatic. Decongestants, and then rarely there's surgical procedures may be necessary at some time. Looking at the lower respiratory tract, this just gives you an idea of the lungs, basically, and all of the bronchus and the alveoli. So this gives you an idea upper, above your head, and then lower, just below. So lower respiratory tract infection is inflammation of the air passages within the lungs, like the trachea or the windpipe, and the large and the small bronchi, which are the airways, with the lungs become inflamed because of the infection. And the two main types are the bronchitis and pneumonia. And this gives you a picture of normal and abnormal, the chronic bronchitis. So you can actually see the inflammation over to your right and the mucus, right? So that's the bronchitis. So you have acute and you have chronic. And the acute bronchitis is usually caused by viruses or the pollutants. And the chronic is prolonged smoking or heavy exposure to the pollutants. So this is where we're trickling down now and getting into the Sahara dust. The bronchitis is just a chest x-ray to show you, and the right is the contrast, just showing you when they use dyes and how it's contrast so the doctors can see. Pneumonia now, you can see a normal to your left, and then you see the fluid filling up in the spaces, difficulty in breathing, the oxygen unable to reach the bloodstream. So this is how pneumonia presents. Signs and symptoms: cough, fever, kind of tiredness and feeling weak, chest pain, shortness of breath, low oxygen level. Causes: it can be viral, like influenza, or even the coronavirus and adenoviruses, RSV. Recently, we had a lot of talk about RSV. We're not hearing as much about it now, but that was a big issue both in Jamaica and in the US, and to a lesser extent Barbados, but we were still making sure that we educate persons. Bacteria, things like Streptococcus pneumoniae and Haemophilus influenza and mycoplasma, that can also cause it. And then some of the risk factors are age, or if you're immunocompromised. So physical or close contact with someone who has upper respiratory tract infection can also lead to the lower respiratory tract infection. Poor hand hygiene. So this is where you have to do your part. Make sure you wash your hands often. Close contact with children in a group setting. Like if you're at daycare center, sometimes you wonder why children always have a cold, especially if they go to school, if they go to daycare, because there's always that close contact with groups. If you're traveling on the airplane. The one time that I still wear my mask, Brother Jeffrey, is when I am on the airplane, okay? So I know you're traveling soon. So through the airports, I make sure I wear my mask all the time. When I get on the plane, I wear my mask. I just take it off probably to eat and put it right back on. But you still have to be careful. There's a lot of COVID still out there. But not only COVID, but prevention in terms of upper respiratory, lower respiratory tract infections. So immunocompromised state, persons that are like, if you have HIV or if you're on steroids or if you have cancer and you might be taking chemotherapy, things like that, you have to be even more careful. Home remedies, we mentioned steam before, making steam in the shower by turning on a hot water and breathing in the steam air, drinking warm beverages, using vaporizer to create humidity in the room. This is for probably cold countries. We definitely don't need all these vaporizers here. Avoid cold, dry air, and honey and lemon still tend to work. All right, I'm just going to touch on asthma. Asthma, the definition, I know that some of you here suffer with asthma, is defined as a chronic inflammation disease of the airway that is characterized by increased responsiveness of the tracheobronchial tree, and I showed you that before when I showed you the diagram, to a multiplicity of stimuli. And there's extrinsic and intrinsic stimuli. And to your rest, you'll see some of the causes, the air pollution, and we look at that when we look at some of the Sahara dust, smoking, dust, pets, chemicals, and then there are always the genetic factors that you can hardly get away from, family history, and certain genes that we might have. So the etiology of asthma, a lack of exercise, less stretching of the airways, there are genetic factors, there are environmental factors, some that we can deal with and some that we have difficulty dealing with. Things like house dust mites. Before, everybody used to have a carpet in the house. Y'all remember those carpet days? And the carpet will hold a lot of dust. I remember actually getting rid of my carpet because of not having asthma, but having a lot of allergies. Yeah, so there are certain things that we can do to protect ourselves. Exposure to tobacco smoke. Right now, the government actually have laws in place, tobacco laws in place to help to protect the whole society. We could have been saying, yeah, but it's my right to smoke, it's my right to do this. But they realize it's not just your right, it's the right of the other person as well. So tobacco smoke. Then there are pollens, moles. Usually in the US, I don't see as much in Barbados, but when there's a high pollen, they usually do pollen counts. And when there's a high pollen count, then people with bad asthma avoid going outdoors. And this is something that they do on a regular basis. I think here, I used to see it before, I don't know if it's still in the newspaper, where you have the pollen counts, and asthmatics could actually go and check to see what the pollen count is like this particular day. But I don't see that as much now. All right? Symptoms, chest tightness, shortness of breath, rapid breathing, wheezing, coughing, and tiredness. These are some of the symptoms of asthma. So now we get to the African dust. And if you look at the picture, you can see a mass of African dust. Sometimes we ignore it or we don't know what it is, but the African dust transported every year, mainly from Sahara Desert, the arid regions of North Africa, and it contains mainly sand, has a lot of sand in it. But here is saying not biological material, but you will see some of the research is showing slightly different. Mainly transported between May and August. So we probably coming now towards the end of that transport. But with climate change, as you would know, things are lasting longer. They're saying that it's getting hotter, we're having longer summers. So maybe we might see more of it in September as well, even though they're stating May to August. Then there's low visibility. So you see, especially on the cars and on the windows, all of the dirt, etc. This is a picture that I actually got from Dr. Blades, showing a hazy day caused by the African dust. And this is approaching Sky Mall from the Barbados Water Authority. So you can see it actually looks as though it's, you know, a hurricane approaching or something, but this is actually African dust that we are seeing there, all of the haziness and the whole blanket of dust coming across. Now, sampling in Barbados has started a long time ago up in St. Philip, and this is where Dr. Blaze would have done his PhD. He would have gone up into this tower and did quite a lot of sampling at Ragged Point, St. Philip. So for more than half a century, scientists at it's called the Rosenthal School's Barbados Atmospheric Chemistry Observatory, BACO, have documented the summertime transport of the Saharan dust particles across the Atlantic to the Caribbean Basin and to South America. And what they would do is they would go up with what we call petri dishes, and they would collect all of the samples, and then they would take them to the laboratory to test them to see what type of sand, bacteria, whatever in the samples. This is a massive dust storm coming off the coast of Africa. So all of this is dust, not just clouds that's coming off. And again, this is NASATOM's aerosol index. And when you look at the green and the yellow and the red, all of that is dust. Now, in 1967, there were two companion papers that were published that conclusively demonstrated that the large quantities of African dust were routinely being transported across the Atlantic to the Caribbean. So this is proof. So they actually did research, and these papers were published. And Parkin had begun his research on cosmic dust in the late 1950s. And in 1965, he initiated studies in the trade winds on Barbados, and Barbados dust was definitely attributed to the specific African source region using satellite images. And this particular day is when they had some of the most dust, on the 11th to the 12th of June 1967. An intense dust event yielded an unusually large concentration of particles, and this was actually proven. So the Saharan air layer over Barbados on the 26th of June 2007, and this is it that you can see here. You see that massive layer of Sahara dust, right? This was a photograph taken by a commercial aircraft when it was traveling in the air of Barbados, the 26th of June 2007. And the southeast coast is visible, and in the lower right, partially obscured by the dense dust haze. And note the greatly suppressed cloud field. So the clouds are there, but because of the dust, they're greatly suppressed. Now, when I was actually preparing this slide, all of a sudden I see Eli just rush forward and say Godzilla, because he believed he liked Godzilla. So I didn't realize that he was tracking what he was doing until he saw the word Godzilla, and then he came. So this particular dust mass coming from Sahara was called the Godzilla dust cloud, encroaching on the Windward Islands on the 21st of June 2020. as seen in the photograph here. On this day, dust concentrations were in the hundreds of micrograms per cubic meter, range with a maximum of 390 micrograms over Martinique. And note in the image that a second dust outbreak has emerged off the coast of West Africa. So before one can finish, 5 days after, the other one will be coming. So that was sweeping across the Caribbean. That's how bad it is and how bad it was at that particular time. So highlights from the studies, and these are the two last slides, and any questions you can ask Dr. Elliot Douglin. Highlights from the studies. In the Benin's DHS Phase 7 survey recorded information on 13,000, just over 13,000 children. And there was a total of over 2,000 cases of cough reported from the 23rd of November 2017 right through to the 4th of February 2018. And in 52 studies where investigations were done, behind impacts of desert dust on health were reviewed. And the desert dust may be a risk factor for inflammatory and allergic lung disease. These studies show this. And then also adhered chemicals, biological and mineralogical components are candidate activators. And then desert dust surface reactions may enhance toxicity of aerosols in urban environments. So the aerosols are already causing issues, and then the desert dust will make it worse. All right, they will have a greater impact. And the last slide now, Sahara dust and its effects. So Sahara dust intrusions have been a cause of global concern in recent times. And I am as recent as about 2 weeks ago, I think the Ministry of Health were having lots of meetings with some of the climate change people, etc. So I don't know if that's what led someone to ask me to do this presentation. So besides minerals, it also transports hydrocarbons, allergens, for those people like me who suffer with allergies, and microbial compounds from Africa. All of this is transported by the Sahara dust. Airborne microorganisms can increase tenfold in the Caribbean atmosphere on days with a lot of Saharan dust. So when you have a lot of Saharan dust, you have a lot more microbes that can cause infections. A study by Days and colleagues done between 2003 and 2005 showed that Sahara dust affected 20% of the days in the city of Madrid, mostly during the hot season, and it led to cardiovascular effects and respiratory effects in the cold season. So sometime after the summer is when they felt the effects. So in addition to increased asthma attacks in the children in the Caribbean linked to Sahara dust, studies from Western Atlantic countries have also claimed associations with increased incidence of meningococcal meningitis and cancer. So this is how far the Sahara dust infection can cause. Satellite monitoring, transatlantic air quality surveillance, and early warnings and reforestation can reduce its effect on human health. So this is some of the things that they can do. And there's a lot of climate change that we tend to ignore. All the deforestation is causing more and more issues. So planting more trees is saying here would be helpful. If efforts are made to reduce the human-made sources of particulate matter concentrations in adverse effects of natural causes might be diminished. So in other words, all of the factories that we have, I don't know if you remember the Prime Minister going to these big high-level meetings and asking them to remove some of these factories to help with climate change. That is the big countries that's causing the issues, and we, the smaller countries, reaping havoc from it. So this is the situation. So I will end here. Any questions on the actual health situation, medical information, Dr. Douglin, you would come to the rescue. If there are any questions on public health, I can answer for you. If there are no questions, then we will get into the reports. So are there any brief questions that anybody might have? No questions? Everything was so clear? All right, so if there are no questions, I would turn over to whoever is doing the report. Thank you very much.